Then our last speaker for this first kickoff session in terms of introduction to BRD is Dr. Dave Dargatz from the Center for Epidemiology and Animal Health of the USDA APHIS. He's our epidemiologist at the CEHA at Fort Collins. He received his DVM from Washington State, and upon graduation, he worked as a large animal ambulatory clinician, initially at Washington State and then at Colorado State, and subsequently he pursued advanced training by completing a food animal medicine residency and master's degree at CSU. He's board certified in theriogenology, and then he earned a PhD in animal science at Colorado State with a primary focus on beef cattle production and management. And he served as an epidemiologist and beef cattle specialist at the CEHA since 1988. In recent years, his focus has been on infectious disease control, food safety, and antimicrobial resistance. Dave.
Thank you. Well, it's a pleasure to be here. I appreciate the invitation from the organizers to share with you some information from a couple of cattle studies that we've done in the NOMS program recently, namely the 2011 Feedlot study and then the dairy heifer raiser study. And you've heard both of these studies alluded to earlier in some of the talks, and I'll delve a little bit deeper into some of the data. I'll do a brief review to set the data in context as far as what the NOMS program is. Then I'll talk a little bit about the methods behind the two studies, and then talk about BRD prevention practices, BRD occurrence, and BRD treatment in each one of these production systems. So I'll be drawing data from 4 different reports that we've published recently. All of these reports are available at the NOMS website. If you don't have access to that or want hard copies, here's a contact address and a phone number, and I'll come back to this at the end of the presentation as well. So just briefly to remind folks what the NOMS program is, it's a USDA non-regulatory program where our mission is to estimate health and management parameters of livestock and poultry operations across the U.S. So it's really to gather data across a broad geographic space, bring that together and make estimates then. It relies on a stratified random sample, usually of producers out there, voluntary participation. The individual record level data are held confidential. We do publish the summary results of those either at the national level or in some cases at the subnational level. You'll see breakouts by region or by herd size or those types of approaches. But the record level data are confidential. The other key point is that these are population level estimates. So these are inferences to that larger national or subnational population. They don't just represent the sample of producers that responded to the study. So jumping in then to the Feedlot 2011 study, which was actually 2 studies in one, if you will. The first part of the study focused on yards with at least 1,000 head one-time capacity. So this represents about 2,000 feed yards across the U.S., and we focused on the 12 major cattle feeding states. We had 2 contacts with those feed yards that participated in the study. At both instances, we administered a questionnaire through a personal interview with those producers, and that happened in the period of August to December 2011. So these yards then represent about 2.5% of the total feedlots across the country, but about 87% of the feedlot marketings in the country. So just so you have some context when we talk about the data for these large feedlots, what we're talking about. At the same time, we did a second part of the study which focused on those smaller yards, those with less than 1,000 head capacity. Some would call those the farmer feeder type yards. That study occurred in 13 states. 5 of these states overlapped with the other component of the study. There was 1 contact with those producers. That was done during a telephone interview with those producers in August of 2011. So those producers in that small size group then represent about 95% of the feedlots that are out there. So while we've got about 2,000 yards in that large feedlot sort of segment, we'd have the other 70+ thousand feed yards out there in this small segment, but they represent about 10% of the feedlot marketings on an annual basis. These are the 12 states, and I think this is no surprise. Heavy focus on that Great Basin area with some additional western states in that 12-state mix. And then for the small capacity feed yards, a much higher number of states in this upper Midwest, the grain belt, and those so-called farmer feeder type situations. Well, to dive right into the data then, as we think about cattle coming into these yards and think about what that might present in terms of opportunities or to control BRD or BRD risk, we can think about where do these animals come from and how are they managed in the yard. So as we think about these large feed yards, those are at least 1,000 head capacity, about a third of these cattle are coming in for custom feeding or in joint ownership with the feedlot. So a little different situation than what we see over in the small capacity feed yards, where in those small capacity feed yards, those cattle are actually being purchased and owned by those feed yard operators. So a much different situation as we look across there. May present some opportunities, may present some challenges as we think about BRD control. You've seen some of this information earlier, but as we ask the question of these large feedlots, what do you value or what do you think makes a difference in terms of the health experience of those animals once they arrive at the feed yard? Clearly, across all of these pre-arrival practices, there was good support that those impact and are either very effective or extremely effective in reducing the occurrence of morbidity or mortality in those calves once they arrive at the feed yard. So a good feeling that what goes on before those animals arrive makes a big difference to their experience once they arrive at the feedlot. So that begs the question then of, well, how can we use that, or what can we do about it, or does it have value? And unfortunately, as you saw earlier, that information doesn't always travel with those animals as they arrive at the feed yard. And so when we asked about the frequency with which information on those pre-arrival processing activities, those things that were valued by a large number of these feedlots, comes with those animals. 7% of the operators said it never comes. About 58% said, well, sometimes we get that, and about a third of the producers say we always get that with the animals that we bring in. So turning that around and thinking about communication going back the other way, here's the flip side of that. The percentage of feedlot by the frequency that the feedlots provided any information back to the sources of those animals. So if we hope that we're going to modify behavior or think about communicating and making improvements, maybe we need a two-way conversation to go on. And so we asked the large feed yards the frequency with which they did that. And a third of them said never or almost never. About a third of them said sometimes we provide some of that feedback. And I think we can all guess when that might be. And then about a quarter of them said, well, always or most of the time, I try to give that information back. So we have some opportunities and some challenges. As we think about BRD prevention then, No surprise, large feedlots, almost all of them are processing those incoming cattle. So doing some arrival processing as they arrive. The vast majority, virtually all of those cattle coming into large feedlots are arrival processed. About 60% of these small feedlots process incoming cattle. Do something with them in that early period after they arrive. And about 83% of those arriving cattle have some arrival processing. Now, there may be a number of reasons for that in terms of where those animals are coming from, were they previously owned by that operation, that might explain some of that, but a big difference there. As we look at the use of metaphylaxis and the use of information about those animals, or the changing what it is that we do with those animals when they come in, about a half of the large feedlots say they modified their metaphylaxis procedures based on the cattle attributes at the time of arrival or the history on those animals. A much smaller percentage of the small feedlots made changes. It suggests that small feedlots have a definitive protocol that they follow as opposed to changing those things based on what they're seeing. In terms of large feedlots making changes in terms of vaccination protocols, similar between vaccination and metaphylaxis in terms of the percentage of operations that are making changes based on the attributes of those animals or their history. For feedlots that initially processed those animals as a group, so that doing some arrival processing, what are they doing? Well, no surprise. Large feedlots tend to be vaccinating for respiratory disease. About 3/4 of them are vaccinating for clostridial diseases. About half are giving some cattle some metaphylaxis, so using some metaphylaxis in at least some cattle. And a high percentage of those feedlots are implanting or treating for parasites. And that results in a pretty high percentage of animals that are vaccinated and a pretty high percentage of animals that are implanted or treated for parasites. Our estimate would be about 1/4 of the animals arriving in these large feed yards would receive some injectable antibiotics, some metaphylaxis then. Small feed yards, less prevalent to do any of those practices on arrival processing. And remember, I told you that arrival processing is less common in small feedlots as well. So a smaller proportion of animals would have these procedures done, but still a pretty high percentage of those animals that are coming into the small feedlots where there's some arrival processing are being vaccinated at least for respiratory disease. In terms of the organisms, the types of vaccines that are being used in large feedlots where we have some data, as expected, many of the viral pathogens are quite frequently used. The bacterial pathogens less frequently used. And so then you can see how those compare with some of the other disease agents that might play out in the feedlot as well, and some of the other available products. As we look at placement of cattle and look specifically at metaphylaxis in those cattle and look at weight groups then, if we look at cattle placed in large feedlots that were less than 700 pounds at placement, about 60% of the feed yards are using some metaphylaxis in some cattle, and overall of those type, and we would say that about 40% of those lighter placed calves receive some metaphylaxis treatment. Among the heavier weight cattle when placed, a little less than 1/3 of the feed yards are using any metaphylaxis in those types of cattle. and a very small percentage of those heavier placed cattle, those sort of yearling cattle, would receive some metaphylaxis treatment. So overall, in this case, we'd expect about 20% or so of cattle to be receive some metaphylaxis. In terms of the types of products that are being used, most commonly those would be macrolides, followed by the beta-lactam products as a group. And the decisions regarding the metaphylaxis, so we asked a variety of potential attributes of the animals or history information that the operators might use in making those metaphylaxis decisions. And the bottom line is there was no single factor, no standout in terms of this is the criteria by which we decide to use metaphylaxis or we change the program. There was good support across many of those different types of potential decision criteria, including the appearance of the cattle, the vaccination status of the cattle, previous experience with cattle from that source, lots of things that get factored into that decision about when and how to use metaphylaxis. So BRD occurrence then, if we think about the occurrence in large feed yards, as you saw earlier, this number, about 16% of those placed cattle in large feed yards, we would say experience bovine respiratory disease at some point. An additional, a little less than 3% experience what the operators are attributing to atypical interstitial pneumonia. And then a relatively small percentage other types of diseases related to morbidity. So as was seen earlier, respiratory disease, and not a big surprise, respiratory disease being the major morbidity and in fact mortality contributor in terms of the health experience of these animals. So as we look at then also for feedlots with cattle affected, the average cost of treatment. So certainly in those cases where we've got mortality, we've got loss of those animals, but there's also a cost attributed to those things. We asked the producers, what's your average cost per case in terms of treatment? And in the case of respiratory disease, across all of these feedlots, the average cost of treatment per case was a little less than $24 compared to about $22 for atypical interstitial pneumonia, and then lower costs when treating other types of diseases, these other diseases that are occurring at lower frequency in the yard. So when you start to add those things up in terms of multiplying the percentage of animals, that's 16% of placed animals that experience respiratory disease times treatment costs, and then factor in death loss, clearly we have a substantial cost to the industry, both in terms of loss of protein production, food production, but also in terms of financial costs. So nearly all of these cattle, as expected, would receive an injectable antibiotic. We have some information about the types of products that are used in the treatment of these animals. About 45% of these first treatments would be using macrolides. About a quarter of them would be using phenicols, and about 16% would be estimated to have been receiving quinolones for respiratory disease in those large feedlots. Injectable antibiotics aren't the only treatments that are used. We collected some data on ancillary treatments in addition to those as well. And so a smattering of other types of treatments are used. In terms of the percent of those cattle that are treated, about a third of the respiratory cases would receive a vitamin C injection. About half would be revaccinated for a viral pathogen. About 20% might receive a nonsteroidal anti-inflammatory drug. So a smaller percentage of those animals, some of these other treatments across the numbers affected in large feed yards. In terms of response rates then to that initial treatment or retreatments of those animals, what can happen to those animals when we discover that they're a case? We broke that out by lightweight placed cattle when they experience BRD morbidity and they're treated. That initial treatment response rate estimated at about 82%. About 4% of those die. About 2.3% are considered chronics and usually realized. And about 14%, 15% are retreated then. In terms of the retreatment success rate, as expected, it goes down. Just a little less than 2/3 of those animals might respond to a retreatment. A higher percent mortality then in that retreatment period. Some more realizers, and then a few of those animals would go on to at least a third or maybe additional rounds of treatment. Heavier placed cattle, we have a slightly higher success rate both at the first treatment and retreatment rate. Slightly decreased death loss, at least at the initial treatment. Fewer realized, and then because we have a higher success rate here, fewer of those animals end up going back for a second treatment. Okay, to switch gears then and move into the second study, which was the dairy heifer raiser study of 2011. So growing industry that the NOMS program hadn't surveyed before, didn't really have any information about health experience or management practices in those types of operations. So the stakeholder community said we really need to know more about these heifer raising operations and the experience there. So we set about to look at that. Unfortunately, there isn't a good list like there is for feedlots or for cow-calf operations or the like. And so we engaged in a lot of list building activities. We worked with the Dairy Heifer Raisers Association and other ways to develop lists to identify people that might fit into this category. And then we sampled off of that list, and those are the data that I'll show you today. Questionnaires were administered by personal interview in the period from April to September in 21 states. These are the 21 states where we had operations participating. I think good broad geographic space and sort of the expected areas that you would see or where you would expect those operations to exist. And this is just a reminder that in the report, the data are broken out on a regional basis, and so you can drill down a little more finely there to find more local type of information. So what do these operations look like? Well, 65% of these operations receive weaned heifers, but 34% received pre-weaned calves. So these weaned heifers coming into the operations, perhaps an average age at arrival in that 100-day range. These pre-weaned animals coming in less than 5 days of age coming into these heifer raising operations. About a quarter of these operations received heifers from a single source. The flip side of that is, of course, 3/4 of them are coming from multiple sources, and so we have animals commingled on these heifer raising operations. So indicating there may be some opportunities there for shared pathogens across those animals commingled from many different sources. 36% of the operations tested animals coming in for BVD-PI status. So an important step in trying to control some of that experience with BVD and the rest of the animals that might be in that operation as well. Less common, perhaps as expected, in smaller heifer raising operations than the very large ones. In terms of what are these animals receiving in terms of vaccination in order to control diseases, and some of these being respiratory pathogens, certainly. I have to point out a mistake on these. This is not percent of heifers, but instead percent of operations, as the main title says. So we can see that there's no universal use of any of these vaccine or for any of these agents. A variety of different agents might be used on different operations, and different in terms of whether those operations are focusing on weaned heifers versus pre-weaned heifers. In terms of the BRD occurrence in these heifer rearing operations, about 18% of these pre-weaned heifers have respiratory disease, and most of those are going to be treated as expected. Certainly not the most common disease experience of these pre-weaned heifers in this. I think we'd all expect that digestive disease, as was mentioned earlier, is a very common finding in those early animals, early in their life. As we look at the weaned heifers then coming into the heifer raising operations, digestive problems being much less common in those, but still about 11% of those animals coming in experiencing respiratory disease. And again, the vast majority of those are going to be treated. Primary antibiotic classes for treatment of respiratory disease in the pre-weaned heifers and the weaned heifers for that part would be in descending order of relative use. Again, the macrolides, the most common, phenicols, and followed by the quinolones in terms of what would be used in these. And there are breakouts in the report if you want to see sort of more detail and in fact, specific numbers for those. In terms of the recommendations or how are decisions being made about antimicrobial use for treatment in these operations, no surprise, personal experience and past history plays a major factor in some of these decisions. But still, 70% of these producers are basing that on the recommendations of a veterinarian in terms of what products they're going to use, how they're going to select those. And that may occur with or without laboratory confirmation, so whether it be empiric therapy or laboratory-driven information. So death loss experience, again, as we break that out by the pre-weaned heifers versus the weaned heifers, death loss due to the digestive diseases being much higher in the pre-weaned heifers than in the weaned heifers, but about 2.3% of these pre-weaned heifers die with respiratory disease, and about 1.3% of the weaned heifers coming into these heifer rearing operations die, being attributed to respiratory disease. Well, there's a lot more information in the reports, and I'd invite you to dig through those and to explore them in terms of the specifics, not only about BRD, but about a variety of other management strategies and health experiences, production endpoints on those animals. I think that general conclusions from what we've seen, the prevention and control of respiratory disease is a major focus both in feedlots and on these heifer raising operations. A lot of effort goes into how do we manage these animals, how do we handle them, how do we treat them. BRD still occurs with a relatively high degree of frequency. Other speakers have alluded to that as well, both in the feedlot operations and in these dairy heifer raising operations, despite a lot of effort that goes into trying to prevent and or manage that occurrence. I think that as we start to tease those things apart, as was suggested earlier, there's some opportunities to enhance the use of existing tools to control bovine respiratory disease. So, and while I think we can all agree that we've got some wonderful tools out there, not in all cases are they being used to the optimum effectiveness, and we have some room probably to do a little better job using what we have currently at hand, even while we wish for Christmas that we'd have a few gifts of more tools in the toolbox. Further research into the epidemiology of BRD and additional technologies for prevention and treatment could help to improve animal health and well-being as well as food production. But again, going back to the previous point, I don't think it all hinges on that. We can still grab some advantage by just using what we have and maybe doing a little better job of coordination and communication, finding ways to make that happen. Again, this is where those reports and many others reside. I'd invite you to explore that. If we can be of help in guiding your search, we'd be happy to do that. If we can include you on a mailing list or an email notification list when new reports are coming out, we'd be happy to do that as well. Just need to let us know how we can help out.
So I'd like to invite our speakers, Dr. Hilton, Engler, Goodrock, and Dargatz to please go up on the podium, please, and we'll have Ryan Lusky will lead us as our moderator for this question and answer session.